Thank you very much. I know obviously we were sort of keen to keep sort of moving on a little bit, so maybe there will be some questions a bit later on. If we can move on to Professor Andy Smith, who's a Professor of Sports and Physical Activity from Edgehill University, talking about mental health and working in football.
Apologies if I am nervous. I'm an Aston Villa fan, so I don't generally do well at this ground. And we haven't been here for a while, and the way things are going, we won't be back again for a while either. So I apologise, and I apologise for my accent. So if anything isn't clear, please do raise your hand. Many thanks for the invitation to come and speak to you today, and I do so really on the basis of working for over 7 years or so in this area, and particularly with Everton Football Club, with whom we've worked both in the community and at the club more generally. And it's already been mentioned, the duty of care review in sport, which I contributed to for the mental welfare dimension with Baroness Tanny Gray-Thompson and colleagues. And some of the reasons for mentioning that is some of the things that came out of that review and the recommendations that we made, and some of the colleagues that we spoke to as part of that, and indeed in some of the other work that we've done, really informed some of the key conclusions that I'll talk about very briefly today, and it will only be a whistle-stop tour. Some of the projects that we've been involved in, and most relevant for football, have included education and welfare in academies. This includes one study to 303 players, 16 to 18-year-olds, as well as education and welfare officers, coaches, and quite significantly we spoke to people in 21 clubs ranging from the Premier League through to League Two, both in England and in Wales. Some of the things that I'll share with you are also based on some of the work that we've done with mental health in professional sport, and these include professional footballers alongside individual Olympic gold medal winners, alongside guys in the high performance pathway, people who are aspiring to make Olympic and Paralympic Games. One of the things which Amy mentioned right at the beginning of the session was really about working with people who are non-players. So who are the people looking after the people? And one of the things that we've tried to begin to do is really to look at the mental health needs and support of those who support players. So they include sports therapists, rehabilitators, the physios, the doctors, the S&C coaches, the performance analysts, who are investing a significant amount of time working a significant number of hours, day in, day out, to enhance the performance, not just of players, but of the organisations. And that was really crystallised most recently in the mental health in sport and physical activity workforce study, which we started just before Christmas. There are several stages to this. It includes a survey of people in the sports world. This is for anybody from professional sport through to your Sunday league volunteer coach. And we've had a significant number of responses already, and I'm going to share some of those things with you. We're currently working through that with a view to launching that with colleagues early April. But I will try to provide some insight into some of the football-specific things that we talked about there. But significantly, as part of that, we invited a number of colleagues to contribute to that in the form of interviews. And we've been overwhelmed at one level with the number of people wishing to speak to us, including CEOs of organisations, owners, sporting directors, players, physios, and a whole variety of others who work in the workforce. And we deliberately, in that context, tried to broaden the definition of what we mean by worker in this case, and present for today, the performance sport area, to include all of those non-playing staff, to include the receptionists, to include the people who work in the press office, to include colleagues who work in all aspects of the footballing operations. And we've had a good representation of that. In the context of football, and I'm going to start with that, we started with that broad definition. We do think this is increasingly important, that in order for you to provide the best support to players, you need to be in a mentally well position yourself. And in many cases, that's often overlooked. What we found from some of the responses that we've received, and as I said, we will be releasing this with some media partners in April, but so far we've had 234 respondents from the world of football, just over 2 times as many males as females, and one individual didn't disclose their gender. But not surprisingly, what we've begun to find, and what we did with this, was to establish not just the prevalence of mental illness and other types of subclinical conditions, but also, do your organisations have very clear referral processes? Are you aware of your various mental health supports and strategies? Do you engage with those? What are the types of conditions that you experience? Do you know of others? And so on. Really to get a sense of what is the organisational approach and culture like to mental health. So it includes players, but it goes beyond those. We are working currently through the data, but we know already that some of the prevalence, their current experience of mental illness among the respondents across many sports, we're working on the division by roles, it's certainly quite high. It's higher than is often reported for some parts of the general population. I should say we're always very concerned at the beginning that will we attract people who are particularly interested in this idea, and we get a response bias. We don't appear to have found that, because at least 50%, 60% of those who responded to this don't currently have or never have had a diagnosed mental illness, or at least have expressed concerns around their mental health. Others have. Some of the most common forms of illness that are reported by respondents have included anxiety, depression, self-harm, various forms of self-harm, not just in the form of cutting, but also burning, and as Colin and colleagues mentioned also, substance use disorders is increasingly common. OCD and panic disorders were also reported quite prominently in the top 5 or 6 conditions that we have had people respond to us. In terms of their knowledge of others who have diagnosable conditions, the questions were quite precise around this. Again, we see anxiety, depression and OCD being among the more common, but substance use disorders, including alcohol, of course, and other drugs were quite widely known among people with whom they worked in the workplace. So there's a whole variety of things that we'll be talking in more detail around, but these are clearly some of the key issues, not just in terms of prevalence. We want to move not just to establish how big the need is, but also what other elements of the culture of the organisation that we need to take into account if we're to better support the mental health of everybody who works in sports like football. One of the key things, and it's been mentioned already, is really about where to access support. We're currently working on kind of dividing this into different sports and by sectors. There's a significant interest in gaining external support from an organisation. Part of that is related to the fear of disclosure and what will happen to me if my line manager hears me disclose, what will happen to contracts, what will happen around selection. And that can be quite important. But a significant proportion were also interested in seeking support both inside as well as outside of their organisation, outside of the club. It's not all doom and gloom. There were some good examples of respondents and players and indeed other workers within the game and beyond it of mental health policies which supported them in a very positive way. One of the major findings is that this is quite variable, whether you look at the football pyramid or if you compare it to other team sports or individual sports. There's a lot of variable translation of what that looks like in practice. Confidential disclosures, management of disclosures, internal referral mechanisms, including for people who are in CEOs and people who are in very senior decision-making positions who can, in many respects, be quite lonely. And it's quite isolating in terms of their position within the organisations. We have to take that into account. Clearly, some of the things which were also critical, and again, this is not particularly rocket science, but senior leadership support for mental health and obvious, consistent leadership support for mental health was seen as critical. And was commented on positively by those in sports where this was very widespread and well accepted. But in some cases, there were questions raised around, well, whose responsibility is it within an organisation? Is it in some cases, in clubs, education and welfare? Is it safeguarding? Is it the clinical psych? Is it other parts of the performance sport team? And there's lots of interesting material, certainly from some of the guys that we've spoken to, around where that works well and where it perhaps doesn't work so well. The other thing which was routinely commented upon, not necessarily from the players, but actually from other workers, is really the workload and the long hours cultures that are required to perform the jobs which are expected in modern day football and to get people out onto the pitch, whether that's at the Premier League all the way through to non-league. Obviously, the obvious concerns which are well rehearsed around contracts and selection, but also forms of chronic isolation and loneliness. And some of those issues have really come out in some of the interviews that we've spoken to some of the performance and medical staff that we've spoken to. Many of these things, of course, will not be new to you guys. What I think is particularly important for us going forward is how does this play out in terms of mental health, around the management of disclosures, trust and rapport is clearly critical, and the time spent with players or patients or other athletes. Some of these are based on performance medical staff. We've also had other cases where, in one particular case, a female player expressed concern about the disclosure of a bipolar disorder and how that information was used or not used by the club. And some of that concern really fed into the questions which they raised around, and players routinely raised around their interactions with medical staff. This is from one of the sports therapists stroke rehabilitators who we'd spoken to. And clearly this is a critical point at which we can potentially intervene to support the mental health of players, particularly injured players, and particularly those who are even just engaging in rehab, where they may offload and get things off their chest without wanting to jeopardise their position or disclose that to senior decision makers. Clearly, and again, not surprisingly, there was concern about who do you disclose to, or what do you disclose, at what level do you disclose. And a lot of that revolves around selection, of course. Some of those people whom we spoke to actually compared that situation of working in an organisation like that to their private practice, where in private practice, most people are happy to open up. They're not necessarily in the pressurised situation of the sports club, or people won't necessarily know that they've been spoken to or what they're speaking to those colleagues about. So there's some interesting dynamics around that. Now, particularly around some of the more rehab and sports therapy dimensions, there isn't necessarily any dedicated specialist support or training around mental health. There's a reference in some of the proficiencies and standards around psychology, but actually when we ask them around how well do you think you are supported in terms of giving and providing some advice, and do you provide that advice or do you refer on? There was a genuine willingness to provide types of advice where people sought that support, but at the same time that was complemented by a general lack of knowledge and confidence to talk about mental health. These guys weren't necessarily trained in that and weren't necessarily familiar with some of those issues themselves. The challenge here is if players obviously disclose to you things which are confidential, or which they would like to remain confidential, what do you do with that information, particularly if they're not necessarily involved in clinical psychiatry? What we asked them was about, well, what did you do? A lot of them were saying we would just seek to seek help. And the questions there were, where did that leave them legally in terms of providing that information? There was a lot of them who weren't necessarily familiar with mental health, feeling quite vulnerable about what to do with that information. Others, and this raises a number of questions for us in terms of practice, was they would often talk from their own experience. I don't think that there's necessarily enough training sufficient to give advice on the topic. And in some cases, they often talk with willing intentions about trying to support people as if they would do a friend. Now, we know this is clearly not necessarily the common pattern, but there are certainly pockets of the performance support staff that we may need to consider further support, and CPD guidance may benefit this, and indeed it was very encouraging to hear that earlier, that this is one way in which some of the events like this may feed into that in the future. There's a unanimous and fundamental concern among those to whom we spoke in this context about lack of training and absence of guidelines. Some of that comes into kind of early training, because although these guys didn't expect when they were training to practice, to be really engaging in some quite chronic and serious mental illness conditions. Some of them nevertheless felt concerned and constrained to engage on that. So for these guys, we do touch on it. There are yellow flags, but we don't go into a lot of detail. We just refer on. And there's a lot of concern, quite understandably, around boundaries of expertise and professional boundaries. And many of those colleagues tried to stick to those. But clearly the entry and referral points into this was also around training and CPD in relation to what mental health issues are, as they often refer to them, what are some of the key symptoms. And some of the physical symptoms that were being presented by players and by others who presented to these were actually, as is often the case, symptoms of poor mental health. And how do you begin to identify some of that? And there was a unanimous cause and an interest in trying to develop mechanisms of developing knowledge and training, not necessarily to start treating, but actually so they could be feel in a more secure position to refer on to appropriate people. Some of this then began to inform some of the conversations that we had with players around time spent injured. And again, at one level, much of this isn't necessarily new. But this is from a player in the Premier League team, an overseas player, who experienced 2 quite severe knee injuries, which cumulatively led to around 6 to 8 months of time on the sideline. So clearly it's well rehearsed that injury and mental health is very closely connected, and there were various support mechanisms for those guys. But what we often found with these was not just the mental strain of being injured and not playing, but actually the chronic isolation and loneliness that characterised that condition, how that made not just the players feel particularly vulnerable, but it also increased the time spent with performance medical staff who, in some cases, weren't necessarily comfortable engaging with people who they knew or thought had mental illness of various kinds, whether that's depression, anxiety, and other addictions that have already been mentioned. So there's a clear implication here for not just how we treat injury and loneliness, but also about the practice of organisations. And a lot of the things which we've learned around mental health and illness, not just at the high level, but also in academies, is really related to practice that could be managed perhaps more positively than this. And some of this relates to the public presentation of body fat scores, GPS scores, or the forms of running, performance analysis. I won't repeat all of the language, you can read that for yourself, but some of this is not necessarily problematic for some players, not necessarily problematic for others. It may have been that trigger, it may have kind of further undermined some of the conditions which they were experiencing at the time. And a lot of the things that you've seen behind us here, they related to kind of anxiety, the loneliness, not willing to disclose to others, particularly kind of safeguarding and education and welfare officers about some of the conditions that they were experiencing, a whole range of personal problems, relational issues. And some of that really kind of played into also around eating. And I'm kind of going to end on this because I know that we're tight for time. But I think what some of the things that we really have begun to identify is how a lot of these issues overlay each other. And there were colleagues in the room who are far better qualified to comment on that than I. But it is clearly a series of opportune points here, or moments for us to help intervene, to work with players and the medical staff who are supporting those guys. And we hope that we'll be in a position to start talking more about those who look after the people in the next month or two. But I think a lot of the issues, particularly around eating and eating conditions, some of it was known, some of it was with the club's knowledge, others of which wasn't. And some of this is about how it's self-managed outside of the club through extra training or not, and through modified eating patterns. So I think there's a number of things that we can stand to learn. Many of you, of course, will have seen this previously. But I'll end on there because I know that we're tight for time, and I'll hand over to the next speaker. Okay.